the thing that really spurred me on to do a quality improvement project was actually the frustration that I was finding in having to complete a task.
And this all really came about from my first weekend on call, where I was obviously quite nervous and I was asked to prescribe an antibiotic for a patient who had a known penicillin allergy. And actually at the time I wasn't very sure whether it was safe to prescribe it, that particular antibiotic.
The problem I identified was that children were arriving in A&E and being diagnosed with an infection and having a sample taken and then going home on a generic antibiotic before these sample results were available.
And so obviously I tried to look this up and look for references, but at the time I just couldn't find anything that was reliable in order for me to safely prescribe.
And the problem I sort of realised was there was no system in place to chase these outstanding results, and as a result children were potentially coming to harm.
I managed to look into the incident forms and with the clinical governance department and actually find that there are a number of incidents at my hospital where prescription of an antibiotic or delivery of an antibiotic had occurred when it shouldn't have.
We went about fixing it by, it wasn't rocket science, it was just a form, another form I know, which is not great because F1s are overwhelmed with forms, but this form actually reduced the amount of time taken, so it was actually, we didn't really have to persuade anyone to do it. It was clearly a much more efficient way of doing things.
Now, our intervention was not novel in any way. I didn't want to make anything brand new, but build on good work done by other people. And so we used a traffic light system which other people had previously used in other hospitals and tried to bring it to our hospital.
Because having a good idea is one thing, persuading people to support it and use it and then make sure it lasts longer than you were around. I mean, I've moved on from where I was, and it's nice to go back and see it still being used by the new sets of staff.
But I think one of the most important things in this whole process that I've been through is just engagement, making sure that you engage everyone, all your stakeholders, in order to make sure that you make an intervention that actually everybody can take part in, and to ensure that it's sustainable.
I'd say get involved. I'd say just keep your eyes open for things that annoy you, that frustrate you, that you don't think work very well, and your frustrations can be fixed, and you can also learn a lot in doing so. And as your careers go on, I think it should be useful skills to be able to make changes and persuade people to incorporate your ideas and changes into the system that you're working in.